Hi, Dr. Goldberg here, continuing our internal medicine lecture series. Today we're talking about asthma. I'll give you a little update on diagnosis and treatment. So we've got a 19-year-old student, comes in with a history of wheezing, comes into the office with an exacerbation, especially at night. He's seen an allergist. He's been diagnosed with a dust mite allergy. He's got other allergies as well. He uses Zyrtec twice a day, and he's currently using a short-term beta agonist for his wheezing. He's concerned about what he should do to improve his breathing. So when we look at asthma, this was first recognized in ancient Egypt. Treatment was inhalation of frankincense at that time. That's about all they could do. But nowadays, we've got about 300 million cases a year in the world. Unfortunately, about 250,000 people die per year. And the rates of asthma seem to be increasing. About 10% of Olympic athletes in Atlanta in 1996 were on treatment for asthma. Generally, we're going to have shortness of breath, chest tightness, wheezing, maybe some cough, maybe just cough bearing asthma. Nocturnal exacerbations are the worst. The key is to find the triggers. We're looking for GERD, ozone problems, smoking, sulfite-containing food hypersensitivity, sinus disease, allergies are obvious, exercise, URIs, and we're going to diagnose it with pulmonary function tests with methacholine challenge generally. In terms of treatment, we've got about 7 or 8 categories of treatment. Number one, we've got shorter-acting beta agonist inhalers, including Proventil, ProAir, Xopenex. Xopenex, of course, is the L-isomer of albuterol, supposedly having a lesser side effect profile. Maxair inhaler is also in this class. There is a combination inhaler called Comavent or Duaneb, which combines albuterol with the anticholinergic ipratropium. So that can be extremely helpful as well. The longer-acting beta agonists, there's 3 of those. These include Ceravent, Foradil, and Arcapta. The Arcapta is a once-a-day agent. The next category of drugs are the inhaled corticosteroids. There's 6 of those out there. Flovent, Pulmicort, Asmonix, Arabid, Qvar, and Alvesco. So there's quite a few of them to choose from. The next category is the Leukotriene Modifiers, including Singulair, Aculate, and Zyflo. They can be very helpful as an adjunctive treatment for asthma. And then we've got the combination inhalers, which combine the beta agonists with the steroids. There's 4 of those available. These include Symbicort, Advair, Dulera, and Brio-Ellipta. The Brio-Ellipta is the last to come out. It's used once a day. Theophylline is generally not used at this juncture because of potential side effect issues and drug interaction. It's a caffeine-like agent. Anticholinergic agents, I already mentioned, ipratropium can be helpful for immediate relief of asthma symptoms. Once patients are in the hospital, we will do aggressive respiratory treatments, but also add IV steroids and IV magnesium sulfate at times, which is another bronchodilator that can be used in recalcitrant cases. There are some monoclonal antibody agents that are now being used in asthma. Xolair, which is omelzumab, and then dupilumab is the other agent that's available. These are used in tougher cases. They're directed at the Th2 cytokine, either interleukin 4 or interleukin 13. So be aware that they are available for asthmatics that have difficult cases. Otherwise, there's plenty of pharmaceuticals agents out there that are effective for this disease. Thank you, Dr. Goldberg, signing off.